Hello and welcome to Unit 4 of Physics for Radiographers. This is a very brief history of the linear accelerator. At this point in the programme we've split the disciplines. As therapy radiographers, you're going to be in charge of these machines. They cost millions of pounds and legally you are the only people, when qualified, that have the right to switch one of these on and deliver radiation to a patient. Not the medic, not the technicians, just you. So you should get to know them really well. The learning outcome for this quick lecture are to develop an understanding of the linear accelerator and how we came to this point, and to understand the beginnings of isocentric movement. The beginnings can be traced back to the 1940s as part of radar technology in the Second World War. William Hansen developed the magnetron, which was then incorporated into medical use. Varian's a name you're going to become very familiar with. Most of the Linacs in Scotland are Varian made, though you may see others by Siemens, Philips or Electa. The Varian brothers invented the klystron in the 1940s. In the 1950s, the first Linacs were introduced clinically and they slowly replaced most KV equipment. Though we still use a kilovoltage machine in some centres, the Beatson have a 220 kV unit called Extral and that treats some skin cancers. In the 1960s, the main type of radiotherapy unit was a cobalt-60. These had an actual live radioactive source inside that slowly decayed over time. Cobalt-60 has a half-life of just over 5 years. These were in use in Scotland up until about the 1980s, 90s, alongside the Linacs that we know today. Here we have a great photo of the first Linac patient. Look at the size of that machine. And actually, you'll recognise the fact it hasn't really changed all that much. You can still clearly see a collimator and it's on some form of gantry. This is little Gordon Isaacs. He was treated with an electron beam for his retinoblastoma back in 1957. The treatment was to his left eye as the tumour there was localised. His right eye had had to be removed due to the fact the cancer had spread. But he survived into adulthood with normal vision in his left eye. Henry Kaplan was his doctor, who became an oncologist after his dad died of lung cancer. Now we can look at more modern design. The image on the left is more like the old style clinics, and you can see from the diagram that there's a rotational gantry with a waveguide passing along to a collimator. The concertina panel coming out is an imaging panel, allowing for the use of X-ray images to be taken while the patient's on the bed. These were quite limited as they could only take images with MV beams, which limited their quality and only at the angle of the machine head. However, this was a vast improvement on the previous checks, which involved port films on a stand, angled correctly manually to capture an image. These were then exposed and checked. The image on the right is what you will become more familiar with. As before, there is a rotational gantry and collimator. The patient is still on a similar couch, which also rotates, and the machine still moves around them. However, as well as the imaging panel opposing the gantry head is folded away in this image, you can see two perpendicular arms. These can take KV images of the patient, which are much higher quality, and in this particular case, can even perform a CT scan of a short length of the patient to assist in the setup. This is called a cone beam CT. All Linacs have isocentric movement. This means that despite all the moving parts, the beams have a common focus point. You can see a small red dot just above the couch in the diagram on the left. This is the isocenter. Everything revolves around this point. The yellow is representing the radiation beam coming from the machine head, and from the various arrows you can see the movements allowed by the Linac, the full rotation of the gantry and the collimator, and even the table angle. This allows us to treat the patient from various angles as required. Hopefully this very short lecture will have given you a better idea of the machines you will be using in your career and the beginnings of isocentric movement. Next, you can watch the YouTube video linked below on how a linear accelerator works. There are another few narrated slides after that. We can discuss any of the ideas further from this lecture in our tutorials.